Hello and welcome to this series of short videos all about preventing pressure ulcers. This first video will explain to you what a pressure ulcer is and the impact they have on patients. The other videos in this series will lead you through the steps involved in preventing pressure ulcers, including risk assessment, skin assessment, methods of prevention such as movement, nutrition, hydration and equipment, documentation, and an overview of the skin bundle, a mnemonic to ensure that you have taken every step to prevent pressure ulcers developing and have documented this today and every day. A pressure ulcer, sometimes called a pressure sore, is a localized injury to the skin which may be superficial but may also result in damage to the underlying tissue. They are usually found over bony prominences and are a result of pressure or pressure in combination with shear forces or friction. Pressure damage can be caused when using equipment such as plaster casts, neck collars, oxygen masks or catheter tubing. Patients are more likely to develop pressure ulcers if they are less mobile due to illness or completely immobile, for example during surgery. We know there are some medical conditions that make patients particularly vulnerable to developing pressure ulcers, such as organ failure, diabetes, and peripheral vascular disease. Every healthcare professional needs to be alert to the potential for and presence of pressure ulcers, because they can lead to a number of serious outcomes for our patients. Pressure ulcers are painful and can take a long time to heal. This can lead to prolonged hospital stays, loss of employment, poor quality of life, potentially permanent disability, and increased risk of mortality. If the wound fails to heal, the patient may need surgery, which can range from simple debridement of the wound to plastic surgery or even limb amputation. Pressure ulcers can become infected, and the patient will require antibiotics or admission to hospital. There is a real risk of developing sepsis, which is potentially life-threatening and requires aggressive intravenous antibiotic therapy. And yet, it is known that adequate and timely preventative plans can often prevent tissue damage altogether and reduce the severity and impact of existing pressure ulcers. This series will help you to make sure that you have the skills to take the right action at the right time to prevent pressure ulcers for your patients under your care.